Hello friends, today I want to share with you our recent experience with Rezum procedure. I am really happy to say that now I made a video showing a recurrent case, and I recorded the effects of Rezum, our previous operation with Rezum technique, and show how effective it was. Actually, this is a recurrent case. This patient was very happy. We operated him at July, 5th of July, and the initial months he was very happy and doing very good urination. Then he said some of his symptoms come back. So I did a uroflowmetry to him, and the first when he was happy, the maximum flow rate was 20, more than 20, I think 22, 22 centimeter in a second. But then when we do it again, after his complaints raised, he micturated, he urinated with 11 milliliter in a second. So we decided to go for another procedure, and we recommended him to have a conventional procedure like HOLEP or plasma kinetic TURP. But he insisted to have the Rezum again because he said, I was very happy at the beginning and I still want to preserve my retrograde ejaculation. I don't want any retrograde ejaculation. So today we performed a second Rezum procedure, and what I see, I will show you now what we see inside. But I want to say I am very happy with seeing the effects of Rezum steam therapy inside the prostate, because I am now very sure that it is really effective. Before that patient, we were always doing the procedure, but the patients are not wanting to do a second cystoscopy when they are feeling very nice, when they are happy with the procedure. They hesitate to do a second cystoscopy. So also in the internet, I couldn't see much videos showing the procedure, after the procedure, the postoperative periods, and the effectiveness of the Rezum procedure. Now let me show you what happened. Now we are looking inside. This is our Rezum apparatus, as you know. So the first impression, although I did a cystoscopy to this patient at the office, I noticed that left side is very well treated, but the right lobe is staying as untouched. I don't know why, but it seemed to me as there was no effect of the Rezum to right lobe. But it was not true. When I investigated, I see the base of the right lobe is nicely treated. This is the middle lobe part. It is nicely treated, and left lobe has gone. All of the left lobe is very well treated, but the right lobe and the upper part of the right lobe is remaining. The lower part of the right lobe was well treated, and here we are looking and look at the left lobe. It's really the effect of the first Rezum was very nice in the left lobe. There's a remaining apical tissue which we needed to prevent the retrograde ejaculation. So we didn't touch to left lobe in this procedure. We just decided to go for only for the right lobe. Middle lobe is well treated and the left lobe is well treated. I really have no idea why the right lobe is not affected. So this is our first injection. We are giving the hot steam, boiled steam, and you do see infection is coming out. So when I see this infection, I usually do a prostate massage. Sometimes I do it, most of the time I do it before the Rezum, but sometimes in this case, first I didn't do, then I did it during the procedure. So after the second injection, I try to empty the inflammation inside the prostate. So I check the prostate again, and here I'm looking at the base of the right lobe. It is very good, nicely emptied, very nicely treated. Middle lobe, the base of the right lobe, left lobe, and there is only a remaining tissue in the right side. So we are searching tissues again, and I am here. I will do some prostate massages. Let me show it. Yeah, now I am pressing the prostate, especially the right lobe. This patient previously had a 50 to 60 gram prostate and he had infection. So now we are again in the second procedure, draining some inflammation from this patient. You see prostate fluid is coming out by pressing in the prostate. So we drained the prostate and searching the next place to do the injection, trying to make a conclusion if we need another injection or not. Again, the right lobe was still there. I don't have any idea why it didn't disappear. Is there a malfunction of the instrument? Is it possible? Yeah, it's possible. Still I am emptying, draining some inflammation here. Yeah, it may be possible. So we are always discussing with the company how can we understand there is no steam going out when we give the steam inside. Of course, we are looking for the changes. Look at now. This is the third injection. So when I'm giving the steam, I sometimes hear a very big noise. And look at here, the body, the prostate body, the prostate surface is affected with the steam going inside. But we always have some concerns. Why in this patient, the steam, the 3 injections in the initial operation didn't work. Now look at here. Look at the tissues. They are all get widened, and the verumontanum also widened. So we can easily see the effects of the Rezum steam in this part, and maybe here in also left part a little steam has passed to left side of the prostate tooth, so they may have interconnections. So I think this is enough, but I wanted to give a half injection here. So I am now planning a half injection. I put the needle in and just count to 5, and with a short steam I stopped the injection. So now I think this was enough, so we ended the procedure. I was really happy with the procedure, and the most important thing is I understand the Rezum is really effective, and I understand the patients are really, they were true, they were giving what they say after the procedure. They say we are very happy, we turn back to our high school ages in micturition, and this is true. It's really affecting like a real TURP or HOLEP procedure. It is destroying the tissues. So yeah, dear friends, I now proved myself the effectiveness of the Rezum procedure. We see what we did in the 5th of June. This operation was done, and we can easily say the left side was completely treated, just same as a HOLEP, just same as a TURP, and the middle lobe completely treated, just same as a HOLEP, and the right lobe, I don't really have an idea, but some part of the right lobe, and it was obstructing the channel, was not affected. Is this a malfunction of the instrument or technique? I am not sure, but I am still happy to see these results, and our patient will be more than happy now. And what I can say, yeah, we are learning, we are doing, and in the future I hope the results will be better. I wish a happy life to everyone with the Rezum technique.